Hello, and welcome to this educational series called Welcome to Medicare. This program is presented by the Wisconsin Department of Health Services, which is responsible for the Wisconsin State Health Insurance Assistance Program, otherwise known as SHIP. SHIP is a federal program, which means each state has a SHIP program. The state of Wisconsin has SHIP counselors available in every county to help with your Medicare issues. In Wisconsin, you can find a SHIP counselor in your area by going to your local Aging and Disability Resource Center, or ADRC, or you can call the SHIP helpline. The phone number is here listed below. It is 1-800-242-1060. I work as a SHIP counselor for the state of Wisconsin. So if you are deaf, hard of hearing, or deafblind and live in the state of Wisconsin, you can contact me. My VP number is listed below, and it is 262-347-3045. Otherwise, you can email me as well. My email is jenniferm.kane@dhs.wisconsin.gov and is listed below for you as well. If you're from another state, you can still reach out for a SHIP counselor in your area as well to help you with any of your Medicare issues. This presentation will discuss Medicare, and it is divided into 6 parts. This next part is Part 4, and we'll discuss Medicare Advantage plans, otherwise known as Part C, and other types of coverage. Welcome to Part 4 of this series. In Part 4, you will learn about Medicare Advantage plans, also known as Medicare Part C, as well as some brief information about the other types of health coverage. Let's look at the chart again. This shows your coverage choices. First, we discussed original Medicare. Now we are going to talk about the Medicare Advantage plans. This is an alternative way to receive your Medicare coverage. Medicare Advantage plans, sometimes called Part C, cover all of the Part A and Part B services and supplies, and usually include Part D as well. Medicare Advantage plans are run by private insurance companies that are approved by Medicare. You must have both Part A and B to join Medicare Advantage plan. In most plans, you need to use doctors, hospitals, and other providers that are in the plan's network, or you will pay more for all of the costs. Providers can join or leave a plan's network at any time during the year. If this happens, you may need to choose a new provider. You generally cannot change plans during the year if this happens. There are several types of Medicare Advantage plans. Today we will discuss 5. One is the Medicare Health Maintenance Organization, or an HMO. These plans have provider networks. It's important to be sure that your doctor is within network. If you want a doctor but they're not within network,
it means you may have to find a new doctor that is within network. You can get your care and services from doctors and hospitals that are in the plan's list of providers. If you decide to get a service from a doctor outside of network, it means you may have to pay the full cost. The second type is Medicare Preferred Provider Organization, or PPO. These plans also have a network of doctors and hospitals, but with a PPO plan, you can also use out-of-network providers for covered services. Usually it will be at a higher cost. Third type is a Medicare Private Fee-for-Service, or a PFFS. This plan allows you to go to any Medicare-approved doctor or hospital that accepts the plan's payment and agrees to treat you. You can also choose an out-of-network provider who accepts the plan's agreement, but you may have to pay more. The fourth type is the Medicare Special Needs Plan, or an SNP. They are designed to provide focused care management, special expertise of the plan's providers, and benefits tailored to specific groups, including people who live in certain institutions, such as a nursing home, people who are eligible for both Medicare and Medicaid, and people who have a specific chronic or disabling condition. And the fifth type is Medicare Medical Savings Accounts, or MSA plans. They combine a high deductible health plan with a bank account. Medicare deposits money into the account, and you use that money to pay for your healthcare services. Please note that you can add a Part D plan to a Medicare Private Fee-for-Service or a Medicare Medical Savings Account plan that doesn't have a prescription drug coverage included. If you join Medicare Advantage plan, you still are in Medicare with the same rights and protections. You must follow the plan's rules for how to get services. For example, you might need a referral to see a specialist, or if you have to go to providers in a network, these rules can change depending on the year. You may choose a plan that includes a prescription drug coverage. Medicare Advantage plans can't charge more than original Medicare for certain services, such as chemotherapy, dialysis, and skilled nursing facility care. Each Medicare Advantage plan may have different benefits and cost sharing. You may choose a plan that includes extra benefits, such as vision or dental benefits, which are not covered by original Medicare. You cannot use a Medigap policy with a Medicare Advantage plan. If you join a Medicare Advantage plan, you will continue to pay your monthly Medicare Part B premium. People who have limited income and resources may be eligible for assistance with Medicare costs through benefit programs designed for that situation. This will be discussed in Part 5 of this series. There are also other costs that you may have to pay, such as an additional monthly premium to the plan, deductibles, coinsurance, and copayments. These costs may be different from original Medicare, and they may vary from plan to plan. And they may be higher if you go out of network. All Medicare Advantage plans have an out-of-pocket maximum. Once you reach this limit, you'll pay nothing for covered services. The out-of-pocket maximum this year for 2022 is $7,550. This limit may be different between Medicare Advantage plans, and you can change each year. This is something that you should consider when choosing a plan. When making your decisions about your Medicare coverage, it's important to consider the advantages and disadvantages of Medicare Advantage plans. Some of the advantages of having a Medicare Advantage plan is having a lower monthly premium, coordinated care with network physicians, and extra benefits like vision, dental, and hearing, because original Medicare does not cover these basic benefits. Some of the disadvantages of having a Medicare Advantage plan is possibly having a higher out-of-pocket expense, having higher costs when you go out of network. Sometimes there's confusion over plans or coverage, and enrollment is limited to a specific time of the year. Please keep in mind, Medicare Advantage plans can make changes to their coverage, costs, service area, and more each year. These changes are in the annual notice of change, which is a letter that is sent out by the plan every year by the end of September. You should review this letter and consider if the plan will continue to be the best plan for you in the next year. You can compare your plan to other available plans and make any changes during the Medicare annual open enrollment period. In addition to what we've already discussed, many people receive their healthcare coverage through other types of health insurance. Some employers provide retiree group health plans. If your employer provides this type of plan, it's important to check with the plan for coverage details. Some of these plans offer credible prescription drug coverage. The best thing to do is to contact your employer or union benefits admin to find out how your insurance works with Medicare. Another type of health care coverage is military coverage. This is provided through the Veterans Administration, or VA, also called TRICARE. And people who have limited income, healthcare coverage is available through medical assistance, or in other words, Medicaid or MA, or low income programs. This concludes part 4 of the Welcome to Medicare program. I hope this information has been helpful. In part 5 of this series, we will discuss prescription drug coverage options, including Medicare Part D and Wisconsin Senior Care, as well as Medicare's annual open enrollment period. This presentation was brought to you by the Wisconsin State Health Insurance Assistance Program, or SHIP, a free local public service offering Medicare counseling and enrollment assistance to people with Medicare. If you have questions about Medicare, contact your SHIP counselor. You don't have to do this alone.